One of the biggest problems I'm seeing now is moms that are being told that they have a flat nipple when in reality they have a short nipple. Nipples can vary in size, in length, in diameter, in texture, and in how thick or stretchy it is. Some nipples can be really stretchy and stretch super far. Some nipples can be really firm and not stretch at all. Some nipples are short and some nipples are long. Some are wide, some are narrow. I've seen some that look like doorknobs. I've seen others that look more like tubes. I've seen yet others that belly button or dimple in. There's a whole variety of nipples and there is no wrong nipple. Your nipple is the only nipple that your baby will know, and they will not know any different. We also do call it breastfeeding and not nipple feeding, for the very fact that your nipple doesn't matter what it looks like as long as they can latch onto the breast. In my 5-year career as a lactation consultant, I've only had 3 moms that have had nipples too large to feed their newborns. 2 of them had tongue-tie babies and 1 of them had a micro preemie. Their nipples were larger than the size of quarters or half dollars, and they just needed a little extra time for their baby's mouth to grow into their nipple. When you have a truly large nipple, meaning it's measuring 30 millimeters across or larger, oftentimes using a slightly smaller nipple shield and squeezing your nipple into that nipple shield can help your baby to latch until their mouth can grow large enough to be able to comfortably accommodate your nipple. You would definitely want to work with a lactation consultant to help you with that process. But I found when you have a very, very large nipple, meaning if you do an okay sign and your nipple's looking like that, by squeezing that nipple down into a nipple shield, it's like the Cinderella shoe. You're trying to squeeze something down into something a little smaller. You do run the risk of having it be uncomfortable for you, or run the risk that your milk supply won't be stimulated well. So you want to make sure that you're working with a lactation consultant if you feel that your nipples are too large to feed your baby. Although in reality, the majority of the time, 99% of the time, this is not the case. If you have a shorter nipple, your nipple can avert. It can be a little stretchy, but maybe it's not quite as long to reach all the way back into your baby's mouth. When you have a shorter nipple, position is very important. You want to make sure that your baby is as close to you as physically possible. And when they do latch, you may need to press your breast further into their mouth and pull them in closer through their shoulders, because you're literally just trying to mouth, nipple, push your nipple further into their mouth to make sure that it's in a comfortable place in their mouth. Remember, the hard bony point behind where your baby's teeth are going to go is where pinching and pain happen. All the way at the back of their mouth where the palate is soft is where you want your nipple tip, so that when their tongue massages your nipple, it's not damaging your nipple. So when you have a shorter nipple, you really have to work on your position and make sure baby stays as close to you as possible through the entire feeding. If you feel like during your feeding, you get a good latch at the beginning, and then as the feeding goes on, they slide down, you're going to want to make sure to reposition your baby, pull them in closer, press your breast in further every time you feel them wiggle down. You don't want to let them get away with a bad latch, which will cause you pain and damage. If your nipple is really short or even flat, you could also be a good candidate for a nipple shield. A nipple shield basically is going to take your nipple and stretch it just a little bit further to help it get further back in your baby's mouth. Nipple shields are a good tool when it's the correct tool for your situation. So not every nipple, not every short nipple, not every flat nipple needs a nipple shield, but it can be a tool when your baby's learning how to latch, when they're trying to figure out breastfeeding, or if they're a little bit uncoordinated. It can help your baby latch and learn what they need to do to your nipple to make it both comfortable for you and help them learn to suck. So again, there is no wrong nipple. Your nipple is perfect just the way it is. There is no optimal nipple. There's just nipples. They come in a wide variety of shapes and sizes, and your nipple is the only one that your baby will ever know. We do call it breastfeeding and not nipple feeding, so you want to focus more on position to get you a deep latch than really on your nipple. But if you're struggling, make sure to reach out to a board-certified lactation consultant, and we can help you overcome those challenges. Now you know.